Hi everyone, I'm Christy Schumann. I am a certified consulting hypnotist and I am here from Milwaukee, Wisconsin, the good old MKE. And I have been posting lots of videos regarding travel and hypnosis and concerts and even my cat on my page Blondie's Stuff 3039. So if you are here on YouTube, I'd like you to hit the subscribe button and follow me for all my updated videos, and you're welcome to be part of the Blondie's Stuff 3039 family. You're welcome. So what I wanted to do today, I did some deep diving, and I've been reading this book, Hypnosis and In the Relief of Pain by Ernest R. Hilgard and Josephine R. Hilgard. And I've been researching on Google as well, because when I read about something, I go back because I've become very, very curious, and now we feel that you can get a lot of information on Google without having to go to, say, any kind of library and look into journals and get the information yourself. Most of those things have been scanned in and are pretty readily available to you if you just know what to research. So as I was reading in this book, they were talking about how the first person to introduce anesthesia his name was William T.G. Morton, and this was in Massachusetts. This was back on October 16th, 1846, where he successfully put someone under and did a surgery. Prior to October 16th, 1846, all the public demonstrations to put someone under were pretty unsuccessful. In fact, what they had been doing up till then was using wine or brandy or any form of alcohol and hoping for the best. And a lot of people who went through surgeries, operations, whatever they were having done, would have they were slightly schnockered, but they would just be writhing in pain. And so the doctor's assistants would be like holding them down as the surgeon would be going in to try and fix something, whether it be take out whatever object maybe was like in their body that needed to be taken out, like a bullet or whatever, or even amputations or whatever else. It could have been any kind of accident. And so these people would be just wiggling around on the table, and these assistants are doing their best to kind of hold them down while this doctor, the surgeon, is going in and trying to quickly fix the problem. What I also found out was way back, the doctors didn't wash their hands between working on patients because they believed that pus was a natural healer, and people post-op would end up dying from an infection. So a lot of people, when they saw all these other people getting surgeries, they would opt out. They would just live with whatever it is was going on in their body, and they would ultimately succumb to whatever it is that they had going on, or they found some natural healing remedy. Don't know what that could have been. They could have gone through like cupping or acupuncture or something else, and maybe that helped. That's what they relied on because they didn't have the medical advances that we have today in, say, 2025. So when I was reading this, it reminded me of a trip that I took to Prague, and we did this haunted tour, and they took us to the back of what used to be this hospital. I think it was still a hospital, but it was the back of this hospital is where they did a lot of the surgeries, and people would hear screams because they were having surgery done and all they had given them was alcohol. And so the surgeons would walk around almost looking like, well, they were looking like butchers, because the butchers would have these white jackets with blood from, from their business of being a butcher, but then surgeons would too. And so people would beg these surgeons to operate on them for whatever their ailment was, but not realizing how painful it's going to be once they get on the table. So because it was the blood curdling screams, and because a person would be in so much pain and they'd be squirming on the table, these surgeons started to quickly perform these surgeries or operations. And there was one man in London, and his name was Robert Liston, and he could perform a leg amputation in under 30 seconds. Let that settle in. So yes, 30 seconds doesn't seem like a long time. True. But if you're getting your leg amputated, that every second would seem like an eternity. So even though we're like, oh, 30 seconds, no big deal. You know, my aunt, my uncle, my grandpa, my grandma, whomever, they had a surgery and lasted 7 hours. Will last 7 hours now because they can put you under, and then they have time to go in and do things properly. And there's there's quite a bit of medical advancements. But 30 seconds, man, that is something. I also read that there was a man that had been placed under hypnosis before he had his leg amputated. And when he came out, he had claimed that he did not feel any pain. No pain at all. Going through a leg amputation under hypnosis. I practice hypnosis. I can't even imagine that. I can't imagine. And that is some trust right there. But I guess what else are they going to do, right? There was nothing available. And so they started using hypnosis more and more and more because, I mean, what else are there options? You can get a little schnockered, but even that's a risk. Then you're held down. I mean, at this point, hypnosis, okay, I'll do it. So they laughed out, like this hypnotist out, and said that he was a quack job, and that the person who had had his leg amputated was a fraud. Yet his family had come forward with all their affidavits stating that he indeed did not feel anything when he was under, and subsequently when he came out. I mean, so that's pretty powerful. No, I'm not advocating to have surgery without being put under, but I know a lot of people have a hard time being put under and having, if they are put under for any surgery at all, they have a hard time coming out. They get really sick, or they have really bad side effects, or the other things happen. So what I'm saying is there are always alternate ways to do things, and the hypnosis I'm talking about that I want to perform and that I'm doing research for all of you is the pain that even medicine can't take away. That's the kind of pain that I would encourage people to get hypnosis for. So if you were to say have chronic pain, chronic migraines, a lot of people have migraines, and no matter what they do for your hormones, or if you take allergy medication, or if you're getting Botox, or whatever it is, nothing seems to be taking the edge off, and you have to function. And so what I really want to do is help people who have pain like migraines, like migraine pain, but then also other things, either from like they just went through chemo and they have chronic pain now, or they've had like surgery and now they're having like referral pain from their surgery, and it's just there forever now, and they're doing blocks and nothing's helping. So that's what I want to focus my pain relief with hypnosis on. With that being said, I was doing some research, and when I was going through my research, they had mentioned that hypnosis takes wherever you might have a lot of pain, say your shoulder, and they displace it. So they may move it so that the whole body is taking on some of the responsibility, and so it gets so diffused that it doesn't inhibit you from functioning. It doesn't inhibit your quality of life. And recently I had a personal experience while I was like before going to the dentist again, but where he had explained what he needed to do with my tooth, and it resonated with what I had read, and I'm going to share my story with you. You're welcome. So I had just had a molar sort of filled, like with a filling, and he didn't think he was going to need to give me Novocaine, but I'm not perfect at doing pain hypnosis. Again, I'm starting now. So I did not place myself under, and I'm terrified of needles. So he went ahead, he did the Novocaine after the oral gel, and he did what he needed to do, and he shaved different parts like in the top tooth and the bottom tooth to make sure that my teeth were hitting fine. Well, a week later, I was having some problems. And I was having pain up through here, down here, and then into my clavicle. And I said, I have an infection, and come in. So they ordered me some antibiotics, and I went in, and he said, this is what's happening. The top tooth has some very specific points, and it's bearing down on that one point down into your other tooth, and so you're having pain there. He's like, so what I want to do is shave off some of the tooth on both, to when your teeth, when your molars are bearing down on each other, that it's not like on a point, because that's like a shock wave going through your mouth. And so when he was talking to me about that, I was thinking, you're the expert. I find if that's what you need to do. I hope I don't have to have Novocaine again, because that was kind of like, you know how Novocaine is, you kind of lasts for like a few hours, and then suddenly, and you kind of maybe don't feel like you're eating ice cream, like one side is warm, the other side's cold, and you're like, I don't remember that. But anyway, so he went ahead and he did what he needed to do, and I do have a little sensitivity, full honesty, but that it was like an incredible amount of pain, and that incredible amount of pain has dissipated, and that was back on Thursday. So I'm doing pretty good, because now it's Sunday. Anyway, they were talking about how hypnosis can do that for pain. And so if you have pain in, say, your shoulder, then what they would do is put you under hypnosis and displace that pain for you to, say, your hand or like your elbow or something. They would displace the pain so that your shoulder wouldn't be in so much pain that it starts to affect you psychologically. Now, anyone who's had a lot of pain for an extended period of time without any ability to get rid of that pain knows that any respite of pain, even if it's nerve pain or if it's like a constant dull ache, or if it's a searing pain, you want it gone. And if you've been to hospitals and doctors and specialists, and the list goes on, and nothing is being done and nothing can be done, they just don't know what to do for you anymore. So now you're just sitting in this pain. You're entirely uncomfortable. Your quality of life is being affected. Psychologically, you're not in a good space. So dealing with daily stressors is too much. You can get cranky. You can get sharp with people. You don't have a good quality of life because it's constantly there. Or it shows up and it's like searing pain, like ice pick kind of pain. So if that happens, or if anyone has felt that even like once in their life, you understand why anything would be helpful. And so hypnosis, as I'm reading, can help with that by displacing the pain. Now, in one of my other videos, I talked about a cancer patient. It was a case study, and this cancer patient had been placed under hypnosis. They convinced her that her arm was cold, and she had this glove on. had her put a glove on, like imagining it, a glove on, and then it was cold, cold, cold. She was in the, like putting her arm, like in, like imagery in water, and her arm went numb. They had her take off the glove and put it on the arm that was affected, that had all the pain on it. Then she felt numbness in the arm that had the pain, the chronic pain, the pain that could not go away with any medicine, any blocks, anything. She finally felt some numbness. And they had her go through that hypnosis multiple times. Eventually, they went after some of her other constant pain, but she was able to function and use her arm. She was always able to use her arm, but it was always painful. So there are ways that hypnosis can go in and displace the pain, even if it's there just like 1 or 2% or a level 1 or 2, but you can function. And so that brings back this huge quality of life that you've been missing. So if we can go in and we can master hypnosis for pain, imagine what we can do for people who are on meds and feel like they can't get off of meds because they're in searing pain. If we jumped in and we did hypnosis where all they had to do was listen to this hypnosis. Say it was like 15 minutes long. All they had to do was listen to it like once or twice a day. That's it. That's all I had to do. And their pain would be displaced, and it wouldn't come. It wasn't there anymore. They could function. They wouldn't even need all these pain meds, because people who become reliant on pain meds, eventually they stop providing them because they feel like you've become dependent, and then the efficacy is no longer there, so they have to up it. And so then there becomes a really big problem. And then if they stop prescribing those meds, then you are left with having to find ways to resolve your pain. And some people go to street drugs. And then let's accelerate things to the worst case scenario. We have a drug and homeless epidemic. And so I'm not saying that I'm here to solve all those problems, but I am doing some deep dives to find out how we can understand the history of where going under came from, if hypnosis had ever worked in the past, which we know it has, and how it works when we do it today, which is displacing the pain and making it so that people aren't dependent on any pain medication. So I want to thank you for listening to my little history, my little TED Talk or my Christy Talk. And I really look forward to doing more deep dives on hypnosis in general, but on pain hypnosis, and bringing you all along with me. And if you have any questions about pain hypnosis or hypnosis in general for weight loss, for anxieties, for smoking, for age regression, I am thrilled to answer any questions. And I'll even get on the phone with you and talk to you about it. So, but you just need to send me a message, ask questions, and I will get back to you. So anyway, thank you all the way from Milwaukee, and I will see you guys again next.